We're talking about controlling the spread of disease this time, and our cog verb here is explain, and we're looking at these specific types of ways to control the spread of disease. All right, so there's so many ways to control the spread of disease that are very common sense to us, but personal and community measures need to be taken simultaneously to ensure that disease transmission is basically controlled and kept under wraps. So we're aiming to keep as many individuals as healthy as possible whilst also balancing the capacity of the healthcare system. So you can see that here, talking about, making the curve much smaller. We don't want to push the capacity of the healthcare system so that it can't be dealt with. Hygiene is a really interesting choice of word, and it means conditions or practices that are conducive to maintaining health and preventing disease, especially through cleanliness. And that can mean so many different things from an individual perspective. It can mean a lot of different things that are incredibly common sense to us, but don't necessarily always get done because we are lazy. So it might seem really mundane and obvious, but you've got to consider the geographical options as well. It might be that we're talking developing nations that don't have access to clean water. It might be refugee camps. It might be countries that are ravaged by war, natural disaster zones. So many different things can occur that mean that these things that are common sense in our day-to-day lives in very privileged countries are just not able to happen. Okay, so hand washing. Some estimates say that around 80% of infectious disease can be spread via this, by hand transmission, by not washing your hands. So you got to wash your hands at a variety of different times. You should be doing it through clean water, and that's a real challenge for some places. And you've got to be doing it with soaps and disinfectants for a long period of time. So what we were doing, singing happy birthday during COVID or something, I guarantee most of you would not be singing that or washing your hands for that period of time anymore. Hygiene etiquette's really interesting, and etiquette includes, just real basic things that you would think. Don't sneeze or cough on anyone. Washing your hands after sneezing, blowing your nose, things like that. Now, hospitals in particular have so many vulnerable, sick, immunocompromised people. They're all together in one situation. So it's especially important to minimize hospital-acquired infections in this situation. And some countries have these habits ingrained, especially in, Southeast Asia. Those nations usually wear masks when experiencing cold symptoms, just simply to be polite and avoid spreading pathogens themselves. And many cultures are very community-minded, and assuming that anyone could be a carrier of a pathogen, even really healthy people. So in the spirit of solidarity, you kind of need to protect others from yourself. Travel etiquette is really interesting because travel is obviously going to lead to exposure to new pathogens. Even changing schools can, introduce your immune system to new circulating pathogens. As a teacher, that is very, very true. So hand washing and hygiene etiquette should always apply. Obviously preventative medications and vaccinations, depending on where you are going, looking to see if there is going to be an appropriate food and water supply. Maybe you are needing to brush your teeth, with bottled water as opposed to just straight from the tap, and you need to look into places where there might be vectors that are going to be transmitting different diseases and pathogens that way. Now, individual actions are really, really amplified, and if we are individually maintaining really good personal hygiene, this is going to impact the community health as a whole, right? And there's various strategies in place which are usually occurring in the background that have been brought to the forefront of our daily lives when we have an outbreak of something. And while they may seem really familiar, current strategies have to continue. Right? You can't just go, oh, I only wore a mask during COVID, I don't need to do that now. If you are sick, maybe it's really interesting to consider wearing a mask in future as well. So contact tracing is one of the first strategies employed during the COVID-19 outbreak, and it's used to identify, so not just COVID-19, it can be anything really, and it's used to identify and monitor infected individuals and their movements to determine who they may have had contact with either directly or indirectly. So often you'll see with measles cases even currently, this person was at the airport, this person was at Bunnings, wherever they went, you need to be aware of that if you don't have very good immunity to that. So tracing people can allow for really early intervention to minimize that spread, and it's a really crucial part of epidemiology, which is the study of the spread of diseases. And contact tracing can be super difficult when a disease is asymptomatic And as the R0 value increases, contact tracing can be less effective, because if the R0 is 10 and I'm sick, I'm one person, I'm going to give it to 10 people, that's a lot of the community to track down. Now, mass gatherings could be, sporting events, religious worship, entertainment, workplaces, schools, anywhere where a large number of people are coming into close contact and congregating, and obviously restricting these mass gatherings or banning them all together where it's practical, that's going to stop that spread, obviously. So modeling mathematically can be used to plan and predict what's going to happen with these outbreaks depending on the R0. And obviously making some kind of strategies to minimize that risk. So, initially, this is an altered music festival. They looked at changing the infrastructure so, no one was in contact with one another. You might be in a team rotation at work, so this team works from this day and they don't interact with the other team. Flexible shifts to allow people to, come and go, not at the same time, things like that. And this is the Hajj, which is the pilgrimage to Mecca that many people who are of the Muslim faith participate in, and they nicely socially distanced when it was during COVID. Now, temperature screening is a really interesting one. It's usually pretty standard during international travel at borders during outbreaks, and it appears kind of in day-to-day locations as well, particularly during our COVID-19 outbreak. An increased temperature can be an initial sign of infection, so it makes sense, even if no other symptoms are actually present. And screening at airports became pretty standard during SARS and MERS, influenza, bird flu, swine flu outbreaks, lots of things. It's not just about COVID-19. And that increase of temperature due to increased metabolism, due to increased white blood cell activity, that's going to be a very big clue for people, even if they don't feel it. So the skin temperature can actually range between 31 to 37, depending on the part of the body it's impacted. You might be running around, you might be wearing different clothing. And so body temperature screening in this manner, as opposed to, say, just this manner, might be a lot more effective. Quarantining and travel restrictions is one we are familiar with, and we're trying to basically isolate infected individuals to stop the transmission, especially when that R0 value is really, really high. And quarantining those infected individuals at home or at the hospital prevents that spread, but special measures need to be taken. So if you're in a hospital, that PPE for all staff, air filters, separate bedrooms if you're at home, avoiding sharing utensils, cleaning down bathrooms, things like that. And there's quite a lot of border quarantine for objects. So, you can't come back into Australia with a lot of fruit or wooden items or whatever. We're pretty familiar with that. And in Australia, we take it very seriously because we are quite isolated. But, borders can be closed, travel can be restricted outside of your own suburb even, we've probably experienced, and avoid taking potentially asymptomatic infections into other communities as well. Now, decisions need to be made regarding which of these strategies is actually, worthwhile doing, because some of them are quite restrictive. So we need to it's going to depend on the pathogen type, the R0, and the severity of the disease, as well as how quickly and easily people can actually manage these strategies. If we say increase washing your hands, easy to do. If we say stop driving outside of your suburb, that's a bit more challenging. And changes can be made day to day when current and relevant information about, say, the R0, contact tracing, hospital information from epidemiologists, all that stuff, when that information becomes available, then strategies can change. So we're trying to flatten this curve to alleviate the strain on the hospital system. So different strategies are going to need to be used depending on all of these things here. Explain how these things control the spread of disease. So that is usually quite an in-depth cognitive verb.